Hi there. Welcome to this continuing education offering on sepsis, the identification and management of sepsis. And here are the objectives for this continuing education seminar. So the first objective is I want for you to be able to identify SIRS criteria, the causes of SIRS, and interventions. The second is I want you to be able to identify manifestations of sepsis, the causes of sepsis, and interventions. The third objective is for you to be able to identify manifestations of septic shock, the causes and the interventions. And then lastly, for you to be able to distinguish between SIRS, sepsis, and septic shock. All right, if you're ready to get started, so am I. Let's do it. So first up, we're going to be covering content about systemic inflammatory response syndrome, otherwise known as SIRS. So let's start off with just what is SIRS other than systemic inflammatory response syndrome? So it's non-specific. And what does that mean? It means that this is just an inflammatory response to some sort of bodily insult. SIRS is not something that happens in the body in response to a specific type of insult. So it's non-specific. It's just going to give us information that there is something going on in the body that it is trying to defend against. It's an exaggerated immune response. So in SIRS, what the body is attempting to do is to defend itself from whatever the threat might be by localizing and then eliminating the source of the problem. The situation, though, is that it's going kind of above and beyond the normal healthy sort of immune response that we would expect. If I get, a cut on my finger, we expect the normal immune response is going to be that there's going to be vasodilation in the affected area in order to allow white blood cells, macrophages, other things to come in and protect against the bacteria. We're going to see, some localized edema in that area related to the vasodilation. We might see some pain, some redness, some tenderness in that area, but that's going to be kind of the normal inflammatory response to an insult like a cut. What we are not expecting is to see this widespread, exaggerated response, which is what is going on when we're talking about SIRS. So it's also really important to understand that SIRS is potentially lethal. So the exaggerated response is meant to be a defense mechanism. It's meant to be a thing to keep you safe from harm. But the issue is that it can cause this dysregulated cytokine storm, meaning that you just have this inflammatory cascade that is kind of gone out of control. And because of that, we can lead to end organ dysfunction and eventually death. So SIRS, while it may seem like something we encounter very frequently, especially in the setting of the emergency room or acute care, we see SIRS all the time, it's important not to become complacent when thinking about it because it is a potentially lethal start. It is something that can lead to the death of your patient. So for that reason, I want you to remember that SIRS should always be a red flag for healthcare professionals. I don't care who you are, if you are a nursing student, a nurse, respiratory therapist, pharmacist, whatever your role is in the interdisciplinary team, you need to be familiar with SIRS because it is a huge red flag that some sort of badness is going on inside our patient, and we now have the chance to intervene, to figure out what's going on, to identify it, to treat it, and hopefully reverse that harm before it becomes lethal. So very important to understand what SIRS is and why it matters so darn much. So let's talk about what SIRS isn't, and I really want you to hear this because I think we in healthcare see SIRS so often that it really does become this thing that we associate with sepsis. And that is true. In cases of sepsis, there's going to be SIRS. However, not all SIRS is sepsis. Not all SIRS is infection. So what SIRS isn't is specific or diagnostic. And what do I mean by that? What I mean is SIRS is a collection of findings. It is a constellation of presenting findings, assessment findings for your patient that lets us know something is going on inside this body that has the body's immune system really worked up. It is not specific to infection, to trauma, to anything else. It's not specific, so we cannot say with certainty that if you have SIRS, then you have had infection or tissue insult or something along those lines. Those things are possible, but we can't say for sure. And it's not diagnostic. You are not diagnosing a patient with SIRS. SIRS is a finding. It is what you are observing in this patient that then should help us to get to the point of being able to diagnose the primary cause of this condition. So it is not specific. It is not diagnostic. It is non-specific. It gives us information that there is badness of some sort, but it doesn't tell us what that badness is. Let's talk about SIRS criteria because you have to know this. As a healthcare professional, you've got to be familiar with SIRS criteria so that you know who is giving you those red flags. So SIRS criteria include any two of the following. These are the criteria, and positive SIRS findings would be two or more of the following. So let's get into it. First and foremost, core body temperature. Keep in mind that I said core. I'm not talking about a temporal reading. We have to be talking about a core body temperature, and that is important to keep in mind. Now, obviously, if my temporal reading is way above 100.4 degrees Fahrenheit, it's going to be even higher core. But core body temperature above 38 degrees Celsius, 100.4 degrees Fahrenheit, which that is where we draw the line for a fever. Remember, over 100.4 is a fever, or less than 36 degrees Celsius, which is 96.8 degrees Fahrenheit. So again, remember that you might be familiar with thinking of SIRS as being related to infection, and when you think infection, you think fever. And that is true for some portion of this, but also if we have hypothermia, this is a SIRS criteria as well. So if we're living in that middle, the kind of that normal, healthy, happy range, we're doing okay, we're not worried about it. However, if I am febrile, if I am over 38 degrees Celsius, or I am hypothermic below 36 degrees Celsius, 1 point there for me. What else is on SIRS criteria? Heart rate. Heart rate. If my patient's heart rate is above 90 beats per minute, this is positive SIRS criteria. Notice that the cutoff is 90 beats per minute. It is not above 100, which is where we are used to defining tachycardia. This is important because if you are only looking for patients who are truly tachycardic, for patients who are living over 100 beats per minute, then you're going to miss those patients who are just in that beginning. They're starting to have that systemic response, okay? So heart rate greater than 90, positive SIRS criteria. Respirations. Two criteria here again, just like with temperature, it's an either or situation. If your patient's respiratory rate is greater than 20 breaths per minute, or the partial pressure of carbon dioxide is less than 32 millimeters of mercury, either one of those things is a positive SIRS criteria. So if I'm breathing 19 breaths a minute, but my PaCO2 is 30, that is still positive SIRS criteria. If my PaCO2 is 34 and I'm breathing 28 times a minute, it's still positive SIRS criteria. If both things are true, it's just one positive SIRS criteria. It doesn't count as being the second thing that you need. So just keep that in mind. And then lastly, white blood cell count. This is again one where I want you to pay close attention, just like with temperature. White blood cell count of greater than 12,000 per cubic millimeter or less than 4,000 per cubic millimeter. That is positive SIRS criteria. So again, we are used to thinking of infection when we're thinking of SIRS. So we're used to thinking of a really high white blood cell count, and that could be possible. But do not miss the more subtle finding of having a depressed white blood cell count. If we have leukopenia less than 4,000, we need to be concerned for SIRS as well. So again, remember, this doesn't necessarily mean infection, it means badness of some sort. So these are the SIRS criteria that you have to know. And I'm telling you now, if you want to take a screenshot of this page or something like that, do that right now, because this is going to come up time and time again. And it's really important for you to be familiar with it and have it available to reference. Now, the question everybody wants to know is it infection? So my patient has positive SIRS criteria. Do they have an infection? Because we want to jump ahead. We want to jump the gun and say, oh my gosh, they have infection, and therefore it could be sepsis. Slow down for a second. Let's talk about other possible causes of SIRS, because I told you that this is non-specific and it's just a response. It is an exaggerated immune response to some sort of bodily insult. So let's talk about what that might mean. So it could be infection. Let's just get that out of the way. It could be infection, right? Infection that becomes a really big deal for the body and is overwhelming. We're going to see SIRS. Absolutely correct. Tissue insult. What does that mean? Here's some examples for you. Things like surgery or trauma. So if I cut myself deeply, if I am cut surgically, if I were to have, some kind of crush injury or, anything that's going to be considered a traumatic event for my body, trauma, surgery, those things cause tissue insult. So we are disrupting the tissues of our body, and that can lead to SIRS. What else can cause SIRS? Ischemia. So any form of ischemia can cause this sort of systemic response. So this could be your patient who is having ST elevated myocardial infarction. This could be your patient who was suffering a crush injury and they have ischemia to that leg. All of these types of tissue ischemia can cause SIRS. Along with malignancy. This is one that is often overlooked, but your patients who have malignant cancer are likely to also meet that SIRS criteria. So don't miss that, especially if you are working with a population who is like, if you're working with oncology patients or something along those lines, keep in mind that malignancy can cause SIRS. And then reperfusion, what does that mean? So once we are able to reperfuse an area that was previously ischemic, we can also see SIRS happening in those cases. So again, coming back to that crush injury, we're going to see SIRS because of the ischemia. We're going to see SIRS because of the blood flow reperfusing the injured area. Okay, so keep in mind, it's not always infection. It might be, but we need to just investigate further. So what do we do about this? We've identified what SIRS is. We've identified how we can see it, how we can identify it in our patients. Now, what do we do about it? I'm so happy you asked. All right, so first and foremost is notify the provider of any patient who is meeting SIRS criteria, meaning 2 or more of those 4 criteria buckets, if you will. If you have a patient, and as an ER nurse, I am very much working shoulder to shoulder alongside the physicians and the advanced practice providers in our hospital. So they are going to also be rapidly assessing this patient and coming to see them. But in my hospital, we have what we call sepsis alerts. And so this is going to vary based on facility. But if I have a patient who is meeting SIRS criteria, and I believe that this could get to be a bigger thing, I am going to talk to the doctor first, say, hey, listen, I got this guy in 45. He doesn't look good. He's meeting SIRS criteria. He's febrile and tachycardic, or, he's tachycardic and tachypnic. I don't think that this is infection, but I think something is going on. Could you come take a look? So we got to be on the same page. When you are working inpatient, like maybe in a med-surg unit or other types of acute care settings, keep in mind that this could develop at any time. So you might be caring for this patient for several days. Maybe they had surgery and they came back to you after an appendectomy and they're doing great. Everything is good. And then on day 2, they start not doing so hot. You start to notice that their pulse has kind of been rising, and now we're at like 95. And I was looking at their white count this morning for morning labs, and I thought it was over 12. That right there, your patient is now meeting SIRS criteria where they may not have been in your previous care. So very important that then you make that phone call, page the doctor, whatever it may be, to notify the provider this patient is meeting SIRS criteria. So whatever that means for you in your practice setting and context, absolutely apply it how that means to you. But let's talk about some other things. We've got to identify and treat the underlying cause. So one of the things that we want to do is assess for a potential source of infection, and that will have to do with the identification of sepsis. But with a patient in SIRS criteria, meeting SIRS criteria, I need to think, is there something going on that is an infection? So if my patient walks in through the front door, I can usually rule out big things like huge traumatic injuries, that kind of a thing. I can usually put that aside. Unless they have had recent surgery, I'm not really worried about that. So if they just present looking not well, I need to figure out what's going on. So I'm going to figure out, what is the presenting complaint? Do you have any other symptoms? Are you having respiratory dysfunction? Are you tachypnic and telling me you feel like it's hard to catch your breath, you can't breathe? Okay, I'm now thinking that we could have a pulmonary source of infection. So maybe we need to get an ABG and order a chest X-ray and all of those sorts of things. Maybe we can't really identify a source of infection, but we still need to be drawing labs. So if you have a patient who meets SIRS criteria, I want you to notify the provider and then start assessing, collecting that data. So I'm going to draw labs, specifically CBC, BMP, lactate is a big one, and we'll talk about that in a minute, and blood cultures, or whatever I think is appropriate. Maybe my patient is complaining of pain with urination. I'm going to get a urine culture. Maybe they have an obvious wound. We should get a wound culture. So whatever is contextually appropriate for your patient, you got to start investigating that. Also keep in mind that some facilities have order bundles. They have bundles where you can click and it will order everything that your facility wants you to order in these cases. So do some investigation and see if you have a facility policy for standing orders. If a patient meets SIRS criteria, do I, as the nurse, have the ability to place standing orders per protocol, per our facility policy, so that I can get these things moving? Or do I need to wait for the doctor to put in orders? So just investigate your facility so you know what to do in these sorts of circumstances. Supportive treatment is very likely going to be what we do for a patient in SIRS. Until we can identify what is going on, identify the underlying cause, and treat it, we need to just support our patients. So IV fluid resuscitation may be indicated. It may not be, depending on the context. Another example would be antipyretics. If your patient has a fever, then let's reach out to the provider and see if we can get an order for antipyretics, acetaminophen, something like that, to bring that fever down. Whatever the patient is presenting as, we're going to provide that supportive treatment to treat those symptoms and hopefully get them feeling better and doing better as well. And then this one is, I want you to learn it, love it, get a necklace that says it, assess for end organ dysfunction. If I have a patient who is meeting SIRS criteria, even if I cannot identify a source of infection, I still want to be thinking, is there the potential that my patient is already past SIRS and we are experiencing some sort of organ dysfunction, which now complicates this picture? So there, and we will talk about this shortly, but there is the sequential organ failure assessment known as SOFA. There is QSOFA, the quick sequential organ failure assessment. And then there are other ways to assess end organ dysfunction, such as looking at urine output, creatinine, BUN, things of that nature. So whatever, again, is appropriate for this patient and this situation, I want you to be thinking, I need to assess for organ dysfunction in this patient, whatever that means for this situation. I just gave you a whole bunch of information about SIRS, which again is the systemic inflammatory response syndrome. And there's going to be some questions for you to test your knowledge of the information that you just learned. Don't worry, you're gonna do great.
Question number 1. Which of the following are potential causes for SIRS? Select all that apply. A, acetaminophen use. B, recent appendectomy. C, motor vehicle accident. D, headache. E, urinary tract infection. The correct answers are B, C, and E. Causes of SIRS include trauma, surgery, and infections. Question number 2. Which of the following findings meet SIRS criteria? Select all that apply. A pulse of 121 beats per minute. B, a white blood cell count of 17,000 cells per cubic millimeter. C, respirations of 19 breaths per minute. D, a temperature of 38.7 degrees Celsius. And E, a blood pressure of 90/64. The correct answers are A, B, and D. The respirations are in normal range, and blood pressure is not a component of the SIRS criteria. Question 3. Does a patient with the following vital signs and laboratory findings meet the criteria for SIRS? A pulse of 103 beats per minute, respirations of 18 breaths per minute, a blood pressure of 98/58, a temperature of 39 degrees Celsius, and a white blood cell count of 19,000. The answer is yes. This patient has 3 of the SIRS criteria present, including a heart rate over 90 beats per minute, a temperature over 38 degrees Celsius, and a white blood cell count over 12,000. We invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. And if you found value in this video, be sure to hit that like button and let us know what you found to be particularly helpful.